what I do in the most cases, I try to give some easy prompts. This one is just a cat running beside a horse in the city. It's something what didn't happen in the nature often, because a cat is running away from a horse. To check what the system can do, what it has not been trained on in a good way. So all this training data, and I think here it's again a little bit what we can see here. So cat looks a little bit like a horse. I'm not sure if it makes sense in the health sector to use such a technology. On the other side, also the video detection, like vision or something, are really important for your industry, I would say.
Definitely. From the standpoint of video creation, I think in the future that there are ways of using educational content, and right now it's labor intensive. And with features like Sora, we have a vast potential of creating information and guides mass public. A receiving side, I think computer vision has a vast untapped potential where there is a number of really that highly valued and validated startups in computer vision world that continue to maintain just a little bit more of a niche presence. We have to outline what is computer vision and what is AI good at, and that's pattern recognition. So computer vision applied to healthcare is a tool that can enhance human capacity to recognize these patterns. And the entry point, the price of entry, has been diminished to the point where it's essentially almost nothing to install a computer vision feature into your digital health application. Unfortunate truth, though, at least in the United States, is that the reception in the clinical community has been less than perfect. So even these products with computer feature integration, now computer vision is just not being utilized. Most patients tend to revert back to their two-dimensional models or to two-dimensional explainers, most likely because of comfort and prior experience, right? So the cardinal mistake with computer vision thus far has been not educating the consumer about the proper application of it. Computer vision can be trained to identify these failures or the shortcomings in performance, and can be applied in the industrial space, so to reduce injuries in this manual labor specific, but also in a clinical space, detecting features or motions that are unique to humans to reduce the likelihood of things happening like falls, right? Where we know that the economic burden of falls in the United States is something like $70 billion a year. And right now we're only managing falls after they happen. So we don't do anything to prevent falls from happening. We just manage once people fall. But using computer vision to really screen and identify senior citizens and elderly and intervening before the falls occurs.